All right, welcome back to Better Kansas City. Thanks for joining us here this morning. Their goal is to make you feel as welcome and as comfortable as possible when visiting the doctor. And Dr. Stephen Salanski explains what makes Partners in Primary Care different.
I'm a family physician. I've been practicing in Kansas City for over 30 years. And for the last 2 years, I've been the medical director at Partners in Primary Care, which really brings a whole new game-changing approach to the care for seniors.
Okay.
We're paid differently. We can spend more time with our patients. We have a whole team that helps to take care of those patients. And we have 8 locations all across the Kansas City metro area. 4 of those are freestanding locations, and 4 of them are actually within Walgreens. And people are surprised when they walk into Walgreens and they see this full doctor's office within Walgreens. So we're currently opening our 8th center, which is in Overland Park in the Walgreens there. And people can come through and get the opportunity to see the Discovery Experience, which tells them about what this is going to look like. It's not completely finished yet, but we're anticipating opening late January.
Oh, cool. Well, congratulations. That's fantastic news. And how great is it, again, that you have some of the freestanding locations, but then just at your neighborhood, you know, Walgreens, your drugstore right there, boom, there you are.
Right. Everything in one place.
Okay. Well, New Year is always a perfect time to talk about your health, always the new resolutions and everything coming out. Why is it so important for seniors to start, you know, thinking about health goals here at the beginning of the new year? 2020, got to start it off with good vision, right?
Oh, yeah, that makes sense, too. But Medicare recommends that all seniors get an exam once a year, and they don't call it a physical exam anymore. They call it an annual wellness visit.
Okay.
And so as you think about people making resolutions for their health in the coming year, it's a good thing to start planning ahead and to consider getting that appointment time with your physician so that you can actually do this thing called the annual wellness visit. Okay.
Now, what about if I'm already healthy, or folks that feel like they're already going down a good, you know, healthy pathway? What about for them in this annual visit?
Well, that's why it's called an annual wellness visit.
Okay.
I mean, we will spend some time talking about your chronic conditions if you have diabetes or high blood pressure or things like that, and we'll talk about the medications you're on. But we spend a lot of time actually talking to you about prevention and talking to you about screening for conditions that you might not yet have. So we'll talk to patients and schedule them maybe for procedures like colonoscopies or mammograms. We will potentially draw some blood to screen for certain illnesses that they may not know that they have. We certainly talk about immunizations, and so the immunizations you can get, like flu vaccines and pneumonia vaccines or shingles vaccine, to help prevent illnesses. We also spend a lot of time talking about lifestyle and changes in your diet or physical activity that really help to enhance your health. We talk to people to be sure that they're not risks for falling. And we also spend some time talking about things that people don't want to talk about. We ask people questions that may help us to see if they maybe have depression or perhaps if they have issues with social concerns, like they're isolated or they're not able to get transportation to places where they want to go, or maybe they're food insecure. They have to decide whether to spend money on food or medicines. And so we ask questions that people may not want to talk about. And the other one that we really talk about a lot is bladder control. People are afraid to talk about that, and we have ways to ask and to talk to people and opportunities to help them if they have those kind of problems.
You can make your appointment today. Call 913-756-1244 or go online to partnersinprimarycare.com/Kansas-City to learn more and connect to one of 8 locations in our area.
We'll get